Ruxience 10 mg per milliliter concentrate, intravenous immunomodulator, and B-lymphocyte stimulator, BLYS, specific inhibitor, also known as Rituximab, is used to treat certain types of cancer such as non-Hodgkin's lymphoma and chronic lymphocytic leukemia. It works by slowing or stopping the growth of cancer cells. This medication can also be used to treat rheumatoid arthritis, decreasing joint pain and swelling. Additionally, it is used to treat certain types of blood vessel disease such as granulomatosis with polyangiitis and microscopic polyangiitis, reducing the swelling of the blood vessels. Rituximab is also used to treat a skin condition called pemphigus vulgaris, helping to reduce the number of skin lesions. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before starting Rituximab, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Your doctor may also prescribe other medications for you to take before each treatment to help reduce side effects, such as fever and chills. Rituximab is given by slow injection into a vein by a healthcare professional as directed by your doctor. The dosage and treatment schedule are based on your medical condition, body size, and response to treatment. Some people may experience mild side effects like nausea, vomiting, headache, or muscle pain when using Ruxience. However, your doctor has prescribed this medication to you because they believe that the benefits outweigh the risks. It's important to let your doctor know if you experience more serious side effects such as stomach pain, swelling, numbness, or signs of infection. In some cases, Ruxience can cause a rapid destruction of cancer cells, leading to side effects like back pain, kidney problems, or muscle weakness. Your doctor may prescribe additional medication and advise you to stay hydrated to minimize these risks. It's also important to be aware that Ruxience can decrease blood cells, leading to symptoms like anemia, easy bruising, or signs of infection. If you notice any of these symptoms, be sure to inform your doctor right away. Although rare, a serious allergic reaction to this medication is possible. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. Please note that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other unusual effects. If you are in the US, you can report any side effects to the FDA, and if you are in Canada, you can report them to Health Canada. The use of Ruxience 10 mg per milliliter concentrate, an intravenous immunomodulator, and a B-lymphocyte stimulator, BLYS, specific inhibitor, may rarely cause serious side effects. These can include severe breathing problems, heart problems, or serious skin reactions such as Stevens-Johnson syndrome. It may also increase the risk of a rare but very serious brain infection called progressive multifocal leukoencephalopathy, PML. For people who have a current or past infection with hepatitis B, this medication may cause serious liver disease. It's important to tell your doctor if you have ever had hepatitis B before starting this medication. Your doctor should order a test to see if you have the infection before starting treatment. If you experience any signs of a reaction, such as trouble breathing, itching, swelling, dizziness, irregular heartbeat, chest pain, rash, blisters, peeling skin, sores on your skin, lips, or in your mouth, clumsiness, loss of coordination, weakness, sudden change in thinking, difficulty talking or walking, seizure, or vision changes, it is important to seek medical help immediately. It is essential to be aware of these potential side effects and to consult with your doctor about the best timing and daily dosage for taking this medication. Before starting Ruxience 10 mg per milliliter concentrate, talk to your doctor or pharmacist if you have any allergies or if you are taking any other medications. It's important to discuss your medical history, including any lung or heart problems, bleeding disorders, or current infections. Be aware that Ruxience may cause dizziness, and using alcohol or marijuana can increase this effect. Avoid driving or operating machinery until you know how this medication affects you. It's also important to talk to your doctor if you are using marijuana. Before undergoing any surgery, make sure to inform your doctor about all the medications you are taking, including prescription drugs, over-the-counter medications, and herbal products. Ruxience may increase your risk of infections or make current infections worse. Avoid close contact with anyone who has a contagious infection, and talk to your doctor if you have been exposed to an infection. Be sure to inform your healthcare professional if you are using Ruxience before receiving any vaccinations. It's also important to take precautions to avoid getting cut or injured, such as using caution with sharp objects and avoiding contact sports. Older adults may be at greater risk for certain side effects while using this medication, so it's important to discuss any concerns with your doctor. If you are pregnant or planning to become pregnant, it's important to talk to your doctor. You should not become pregnant while using Ruxience, and your doctor may order a pregnancy test before starting this medication. Reliable forms of birth control should be discussed with your doctor while using this medication and for a year after the last dose. Ruxience can pass into breast milk, so it's important to consult your doctor before breastfeeding while using this medication and for at least 6 months after treatment. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ruxience 10 mg per milliliter concentrate, intravenous immunomodulator, B-lymphocyte stimulator, BLYS, spec inhib are other drugs that weaken the immune system or increase the risk of infection, such as tofacitinib, natalizumab, and fingolimod. Be sure to discuss these potential interactions with your healthcare provider. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Before starting Ruxience 10 mg per milliliter concentrate, it is important to undergo lab and/or medical tests, including complete blood count, hepatitis B virus, and kidney/liver function tests. These tests should also be continued during the use of this medication. It is essential to keep all medical and lab appointments. Make sure to take each dose of this medication as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is not for home use and will be administered in a hospital, clinic, or doctor's office. It should not be flushed down the toilet or poured into a drain. When expired or no longer needed, it should be properly discarded. Consulting with a pharmacist or local waste disposal company is recommended for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.